So, good afternoon, everyone. Thank you for joining us for this webinar on our local development projects. I'm Karen Noble, I'm Head of Local Development at EIF, and I'm joined by colleagues from EIF and Trafford Council. Trafford worked with us last year, and Laura Barton and Kate Campbell have really kindly agreed to join us today to share their experience and give you a practical description of of what it was like for them, which I think will be really helpful. Before we start, I'd like to quickly introduce the panel so you know who I am. Can I pass to Virginia?
Thank you, Karen. Hi, everyone. I'm Virginia Chiara. I'm a Senior Research Officer at EIF, and I'm working on reducing parental conflict and the evidence generation aspect of the project.
Thanks, Virginia. Laura?
Afternoon, everyone. My name's Laura Barton. I'm a Commissioning Officer at Trafford Council, and my team has been working on the Reducing Parental Conflict agenda.
Thanks, Laura. Kate?
Hi, I'm Kate Campbell, and I work within Laura's team at Trafford Council. So I'm a Commissioning Support Officer working with the Early Help and CAN contracts. But like Laura said, we've really done on reducing parental conflict in Trafford too.
Lovely, thank you, Kate. And last but not least, Bethan.
Hi everyone, good afternoon. I'm Bethan Lemaistre and I am a local development advisor at the Early Intervention Foundation.
Perfect, thank you. So over the next hour, we'll talk through the projects. As I said, you'll have a chance to hear about Trafford's experiences of working with us last year and how hopefully it helped them. We'll also leave some time to take questions. So if you'd like to pop them into the Q&A, we will get back to those at the end of the session. Just for your information, we're recording this webinar and plan is to use it on social media, but just to be clear, only the presenters will be shown, so you don't need to worry in terms of being on the screen or anything. Okay, so if we could move on to the next slide, please, Bethan. So a little bit about context. Thank you. So for those of you who don't know us, Early Intervention is a charity that was set up in 2013, and it's one of the What Works centres that's focusing on evidence, and we support the use of effective early intervention to improve the lives of children and young people at risk of experiencing poor outcomes. I guess our work focuses on three areas. Firstly, it's to make the case for early intervention, particularly with government departments. Gathering evidence, so in terms of what works and kind of understanding the risks associated with or impacting on children and families, but also kind of what interventions and what help is really going to make a difference for them. And then finally, actually helping local authorities, particularly and their partners, to use evidence more effectively. Coming from a local authority background myself, I know that there's very much a focus on kind of performance and reporting on performance, but looking at it from an evidence point of view and actually what difference are things making than the support that we're providing to families really making a difference is often a challenge. So can we have the next slide, please, Bethan? Thank you. So this just gives a bit of context in terms of the projects that we're running. So you'll see in the first box, as I said, we start very much from looking at what the scientific evidence and research is telling us about the risk factors for families involved experiencing reducing parental conflict, but also the kind of the impact on families. And then we also got feedback from local areas in terms of some of the challenges that they are facing in relation to using evidence to inform their PC strategy. And then as a result, we then think we've been developing this suite of tools, as I've said, to help local areas think these through and provide that support from an evidence-based perspective. As you can see towards the end of this diagram, it's as well as local areas getting a lot out of the support that we're providing and using these tools, it's also important for us because we want to make sure that the tools that we develop are firstly useful to local authorities and partners, but also are accessible. So it's possible, they're easy to use. We know people are really busy dealing with operational things, and so it's really important to make sure that the tools that we provide are accessible and useful for people. So for us, the work that we do with local areas is very much about helping us to make sure that they meet that brief. You'll notice there's a link at the bottom, that's to our RPC hub on our website, which if you haven't discovered it already, provides a whole suite of information and tools that might help you in terms of your reducing parental conflict agenda. And I think that's the cue for me to introduce Kate and Laura, who will now talk about their experiences. Thank you.
Right, thank you. So I'm going to just have a bit of an overview of the needs assessment, and Laura's going to focus on the support pathway. So Bethan, if you don't mind moving, thank you. So we applied to do the needs assessment and the supports pathway with EIF, and I think it was fair to say when we first had our first meeting we were quite daunted by this, and that is purely because in Trafford I don't feel we maybe felt we had a good data set to work from. And we had our meeting with the EIF and we had a discussion around the toolkit, but to start off with our needs assessment, we decided to do a practitioner survey. We hadn't really been collecting data around parental conflict for that long and didn't have a great deal of information, so we decided if practitioners could inform us around what they were seeing when working with families, that would be a good sort of starting point for us. So we sent the survey out to early help teams, to schools, to commission providers, just to get a feel of whether they were experiencing conflict when they met with families, what were the risk factors that were causing that conflict that they were seeing, and also the dynamics within the parental relationship. So was it same-sex couples, heterosexual, divorced, separated, together, just trying to get an idea of what the situation was. And then from those results, it then kind of informed us on where we were going to go to collect that data. So within the needs assessment toolkit, there is quite an extensive list of data sources at the back of it to give you a guide. And we kind of picked out where was relevant for us based on that practitioner feedback. So we looked at the ONS, the Children's Commissioner Survey. We used the JSNA for our demographic information and public health. We linked in with our performance team through collecting the parental conflict data that was uploaded onto the early help module. We also looked at our early help panel tracker. So each week we had a panel for one of the 4 localities within Trafford. And on that, within commissioning, what we did was we tracked any referrals that came in that highlighted parental conflict as an issue. And then we also highlighted any other outcomes. So we linked child outcomes to it, environmental outcomes and parental capacity. And that way it gave us an idea of the risk factors that were linked into parental conflict. And I think it was fair to say that once we'd got all this data and information together, we realised we had a lot more to work with than we initially thought once we started digging into it. And I think that was one of the problems, is once you started, it's then knowing where to stop and rein yourself in. So once we got all our data and put it all together, we then worked with the EIF to analyse it. So the EIF kindly gave us a lady who, going to be a bit rude in not knowing her official title, but she worked in public health and she was very good around needs assessment and analysis, and she helped us just sort of guiding us on how to structure the analysis, pulling in sort of key findings from key documents and referring it back to that practitioner survey that we did at the outset. So we based it around those risk factors that we identified. And then once we pulled all the needs assessment together and we'd wrote it and we'd done the analysis, we then linked in, we did a workshop which we invited all partners across Trafford, so internal colleagues, external colleagues. And we had quite a good attendance. So we had 27 people attend from various organisations. So we had schools there, we had early years, we had health teams, youth service, domestic abuse leads, CAFCAS. So there was quite a range of people from various organisations. And once we presented all the findings around the needs assessment, what we'd asked at the end of that session was if everyone attending could think about various actions that they wanted to take forward in regards to reducing parental conflict, and how what we'd learned and found out from the needs assessment could then inform our work moving forward. So from these actions, we've then put together an action plan, and we also asked people within the group to nominate themselves to attend or be part of a multi-agency steering group. So we've now got 12 people on that group from various partner organisations, and the actions that were highlighted within that workshop has now formed an action plan, which then they have now taken ownership of. So yeah, I think that gives a very brief overview of the needs assessment. But if Laura's going to move on to the next slide about
Lovely, thank you, Bethan. That does make it sound like it was a really easy peasy piece of work, and it wasn't, Kay, was it? There was a lot of work involved. But yeah. So alongside the needs assessment, EIF was supporting us with the support pathway as well. And in order to do this, it involved a number of different steps. And the first step was to develop an online survey, and happily EIF had a template which we could use as a starting point. And I think Kate and I found all these templates that EIF were able to share with us a really, really useful starting point, because sometimes with these things you just don't know where to start, do you? But we had something which was fantastic. So we looked through that, the questions within this survey template. We decided to take a few out because it did look, whilst very comprehensive, we thought, I think this is going to be too much for professionals, because we hear that from lots of partners when they're filling in these surveys. They do a lot of them, don't they? We ask them for an awful lot of feedback. So we tried to whittle it down to some key questions, really. And those questions were about what's your service aim or aims? Is conflict a key component of your service? What age groups are you targeting? Are you specifically in one locality in Trafford? Are you across all of Trafford? Those kinds of things. So all of that went into our survey. So we agreed that, and then that was circulated online to as many of our partners as we could think of, really. I have to say, we didn't get a fantastic response initially. We were a bit disappointed with that, so we had to do a lot of follow-up, and we got our DCS involved, and she very kindly sent an encouraging email to all of our partners again to ask that people complete that survey for us. We also extended the time as well, the time frame within which to complete it, in the hope that we would generate more responses. So in the end, we got 31 responses, which perhaps doesn't sound like a huge number, but again, this is where having support from the EIF is so good, because Sue said, do you know what, 31 is a really decent response, and she pointed out that we had a really nice range of different professionals responding to us. So we had people from our early help teams, we had commission providers, we had voluntary organisations, we had some schools. So we had our 31 responses. We did have some missing services, such as health services. We didn't have our health visiting team contributing to this, or school nurses or the police, and we really would have liked them to do that. But Sue pointed out again, you know, we've got a decent number here. We've got a range of providers. Let's work with what we've got. Otherwise, we could be waiting for a long time to get these people to complete the survey. So we parked that, and it's something we're going to follow up. So we're using the information that we have from those 31 responses. So all of that information was gathered, which looked at direct and indirect interventions linked to reducing parental conflict. And we put this into a template, which again was offered by EIF. Just a very simple word template, and within that we've been able to put service name, outcomes, target groups, and what that intervention was focused on. Something that Sue helped us with again was thinking about how we map all of those services in relation to RPC specific levels of service. So we've got universal, we've got targeted and specialist, and that's not linked to our early help levels of need necessarily, that's about RPC. So in terms of universal services, we've got that means where there's no specific RPC risk factor, nor is there a target group. Our targeted interventions are where there is a specific risk factor around this area, all as a target group, and our specialist services are where there is a very specific risk factor around RPC, and there is a specific target group as well. So the EIF were very good in supporting us to think in that way, and use our needs assessment as well to help us map that template, so it made sense and it flowed, and we were able to get a really good understanding of what these interventions were doing, whether it directly or indirectly, and quite where they fitted in terms of universal, targeted, specialist, which cohorts they were focusing on, where they were in Trafford Borough. So it was really helpful to get that support. I think we would have struggled without the EIF support to do it, so it was we were really, really pleased to have Sue on board and have that regular check-in to make sure we were on the right path. So we've shared all of our findings with our multi-agency steering group, and I think that it was very well received. And what we're doing now is trying to promote that. So Kate in particular is doing a lot of good work around our Trafford directory to make sure that we've got all of this up-to-date information on there around this particular agenda, and especially that support pathway, so that people can see what services are in Trafford at the moment and quite how they might fit with families that they're working with. So that was our support pathway. And Kate, shall I pass back to you just for the final slide?
So in terms of how it helped us progress with our RPC activity, I think the work that we've done with the EIF has given us a really good foundation. It's given us our needs assessment. It's highlighted what data we've got, what data we haven't got, and what data we need. But it's shown us what we have available in Trafford and how we can build upon that. And I think by sharing it with all our partners has just really raised the awareness of RPC throughout Trafford, which has really helped us mobilise it and get people involved in it. And I think as we've worked with the EIF and the more we've worked in Trafford, is that you really realise how RPC impacts everybody, and anyone who's got a contact with the family and parents can really help on this agenda. So it's been really helpful in that. It has raised awareness, like I said, across partners, and we've developed some really good relationships actually as a result of this with partners that we've not necessarily had engaged before in RPC. And I think one of the things Laura mentioned is that health didn't really engage in the support pathway, but since we've done this, we now have one of the service managers for health who sits on the steering group. So actually, although they weren't involved in contributing to the support pathway at the time, subsequently we've got some of those other partners now involved in a different way, so that's really useful. It has also helped us develop a really good action plan.
Can I just add in there, Kate, sorry, that we've just this week delivered some RPC training to 2 different sets of health visitors and school nurses, haven't we? And actually, they were really, really great sessions. I was at both of them and could see the conversations that were happening, and they were thinking about the families they're working with and what they could do to support them. So they are definitely on board. I just think with hindsight, maybe we could have done a little bit more about explaining what we were trying to do with those particular health services. Sorry, Kate.
Oh, that's okay. I lost my train of thought now. Yeah, so I think as a result of the work that we've done in the multi-agency steering group that we had, where we presented the findings of the needs assessment and the support pathway, it has resulted in the development of an action plan, which I think is a really comprehensive action plan that we've got. And the way that we've done it, we've aligned it to the planning tool as well. So as we got each of the actions, we tried to put it against the eight themes that are within the planning tool, so that when it comes to updating the planning tool, which I think possibly is at the end of this year when the next submission is, we can say that we've achieved X, Y, and Z linked to these things, and hopefully it'll just demonstrate that we have progressed the level, because we have worked really hard in a lot of different areas. And I think that the way we've planned it, we've linked it into the DWP funding that we've just achieved. So we're looking to use that to recruit a specific RPC coordinator. And then we've tried to align our actions to either a 1 year, 2 year, or 3 year timescale, and then it will link in with that coordinator post as well. So really, hopefully, trying to embed it, and we've sort of shared ownership with the steering group, so that we've aligned actions to various partners as well to try and really get everybody involved. So hopefully, it's definitely sort of taken off in Trafford since this work, and I think without the involvement of the EIF, we definitely wouldn't be where we are now in terms of how far we've come with the RPC work.
Thank you, and thank you so much for giving your time this afternoon. Really appreciate it. I'll hand over to Bethan now, who will explain a little bit more about the projects themselves.
Thanks, Karen, and thank you as well, Laura and Kate. That was really helpful overview of the projects and the sort of structure of the projects last year. So just very briefly, I'm going to touch on kind of the projects for this year in terms of what we're looking to work on with local areas, and then I'm going to hand over to Virginia just to talk a little bit more about the tools and the areas of work. So we're looking to work with up to 50 local areas this year on the local development projects, and we envisage this to be 5 areas working on developing their needs assessment, 5 focused on an outcomes framework, and then we have 5 kind of areas allocated where we're really interested to hear from you in terms of where you need to progress your RPC programme, areas of work that you've already got planned, and to think about how we could align the projects to that. So thinking about your planning tool and your kind of areas of focus, and linked to the IAF tools and some of the resources, and just thinking about how we could perhaps develop those projects with you a little bit more. So we're really keen to sort of explore that a little bit. It's likely that that will need a bit of scoping and agreement in terms of setting up those projects, a little more so perhaps than the needs assessment and the outcomes framework. So we're really happy to discuss that kind of with you individually, if that's something that you identify as being quite useful for you, and perhaps there's an area in mind that doesn't map to those other areas. So Virginia, if I could just hand over to you for the next little while, just to take us through the needs assessment and the outcomes framework, and I shall move us on as well.
Yes, thank you, Bethan. So as you can see, the first set of activities that we want to present today is focused on supporting the local development of an RPC outcomes framework. So we are at the moment working on a new outcomes framework tool based on feedback from local areas we have supported last year. And the tool at the moment includes a brief overview of the evidence underpinning the outcomes framework, a single page summary of a model outcomes framework, which is actually what we have in this particular slide, and then a definition, well, a list of definitions of child outcomes and risk factors that currently make up the outcomes framework, some examples of symptoms experienced through the life course, and some measurement tools that can be used to assess those outcomes. So as part of the outcomes framework, we also have the risk factors that we know are quite important if you want to reduce the risk of parental conflict. Local areas will be supported to develop and use a local outcomes framework. Typically, this work is part of a work on the local performance or data dashboard, service evaluation, or a local needs assessment. And as part of this work, we can support local areas to reflect on how different risk factors that can be identified at the local level can be linked to the risk of parental conflict, how to make sure that you can monitor risk factors, and of course, how to make sure that you can identify the outcomes you want to improve based on your local needs, but also based on the services and interventions that you have available at the local level. And as part of this work, you will be able to also discuss with us how to make sure that you can assess improvements for different outcomes. So for child outcomes, but also outcomes for parents. So for instance, reduction of parental stress or reduction. Also the outcomes frame with the needs assessment tool to inform the theory of change of the local RPC program and to justify the needs for the activities as described in your theory of change. You can also use the needs assessment to develop baseline data against which you can monitor changes and improvements. And you can also use the needs assessment to start thinking about evaluation plans and to support local decisions on how resources should be used to meet current population needs. And finally, you can also use the needs assessment to identify links with other strategies, such as those of early help, domestic abuse, and troubled families. So overall, the needs assessment can help you to plan your strategic work around the reducing parental conflict support, but also to understand better how your different services interventions can meet the needs of your population. So in this slide, you have the different steps that are described in the needs assessment tool, and EIF can provide support to make sure that you can progress from step 1 to step 6. Step 1 is about the development of a demographic profile of your population. So to start thinking about your population and what you know about the risk factors and some of the outcomes you are monitoring at the population level. Step 2 is on the collection of data to assess the local level of needs. And this is likely to be very linked to some of the RPC risk factors. So it may be about data on mental health issues for parents or financial stress, which we know can be linked to a higher risk of parental conflict. Step 3 is about checking your data, for instance, to ensure that the data is consistent or is valid and reliable. Step 4 is about the analysis of your data to identify local needs. And as part of this work, you will also be able to understand well, what needs your population have, but also the point at which you need to bring in some additional information, such as system assessment or understanding of RPC support, to make sure that you can fully understand what your population needs from the RPC support. Step 5 is about using the data to address identified needs. As part of this step, you will also think about gaps in support. So it might be, for instance, that you will identify a higher risk for some families, but at the moment you don't have support targeting those specific families. So it will be about making sure that there is consistency if you consider the support you're providing and your population needs. And finally, step 6 is about a reflection on your data collection process and how to make sure that you can report what you know about your population. So in this case, EIF can support you through the different steps. Of course, there will be also some templates to make sure that you can collect the data, analyze the data, and think about the support you can provide to your local population. I think that's all from me, so I will hand over to Bethan again.
Thank you, Virginia. That was really helpful. Thank you. So I'm going to talk a little bit more now about the structure of the projects and sort of what we mean when we say local development projects in terms of support from EIF and sort of how we plan to organise that. So last year, the areas that we worked with fed back that having opportunities to sort of come together and that informal peer support was a really helpful aspect of the projects. And we reflected that that could be developed a little bit further this year. And as well, because we will have local areas working on similar projects at similar times, there's a real opportunity to come together, sort of share learning, work through some of the challenges together. So we've tried to build in some more of that sort of peer support opportunity throughout the course of the project. So in terms of a sort of rough timeline and what we're proposing in terms of the support from EIF around the project, we're looking at kind of August time to set up the project, sort of to get things underway, but really just in terms of kind of the paperwork, making sure that kind of there's that key point of contact within EIF and within the local areas, and just getting the project set up. And then we've looked at sort of building in a joint kickoff meeting, so going through some of the tools together, looking at some of the challenges, answering any questions and going through that. And as we start the project, so there's that opportunity sort of first off to start developing those relationships across local areas. And then the ongoing project support in terms of the time scale is sort of to be agreed. That will depend on your projects, but this is a sort of rough idea of what we're planning in terms of that support. So we've built in opportunities to sort of come together at different points to work through sort of if there's lots of shared challenges, an action learning set style event, or perhaps if it's more that's kind of there's different challenges in different areas, thinking about a surgery style event where we can kind of bring some of those questions together and then think jointly about how we might respond to that. And then there's the ongoing sort of project support. So we will, as I mentioned, sort of there'll be an allocated point of contact to EIF, and you'll have regular meetings with them to really kind of get into the detail of the project, discuss how things are progressing, look at kind of what's coming up and what needs to be planned for that, the work that needs to be done, consider any outputs, think about kind of how the work is structured, and just really have that shared space. I think there were reflections in the projects last year that it was just really helpful to have that protected time to come together and really focus on the RPC project, whether that was the needs assessment, the outcomes framework, or something else. We've left it a little bit more open with the final 5 projects, just because that will depend a little bit on what those are. So we'll need to sort of agree that with you at the start of the programme. And then just looking at we had a really interesting session last year where areas were able to come together and sort of share their learning from the project and how they were taking the work forward, which I think was really helpful in terms of kind of, again, just ideas and having that shared sort of space to come together and talk about the project. So we've tried to build a little bit more of that in. And then there's also the opportunity to bring in the expertise of our evidence and research colleagues in terms of supporting the projects where that's really helpful. So Virginia talked about some of the analysis, but there were other areas last year where it was really helpful to have that input in terms of just really developing the work and having that challenge in terms of the evidence base and where that had been developed and come from. So that's something that we'll build into the projects as well. So just on the next slide, this is a little bit more about what we'll need from you. And I'm aware it looks like a long list, but just to put through kind of try and put a little bit of context around that. We really will take a collaborative approach to this, and sort of we understand some of the challenges around local area resource and the challenges around capacity and allocating that to this work. So I think it is important to highlight the capacity that is required, and also just that these are projects that are led locally with EIF support rather than EIF sort of leading the project, and we'll work with you to make progress and to overcome any challenges, but ultimately the projects are led and developed locally. So a couple of things, and really this is based on what we found really helps support the smoother running of the project. So identifying a project manager, and typically in the past this has been the local area single point of contact for RPC. And I think the second point looks at sort of identifying some analyst or performance capacity to support the project. And again, just to say, we understand that can be really challenging, and I wouldn't want it to put you off applying, but it's really helpful for us to understand that at the start of the project, in terms of the likely capacity that's available for that sort of work. And before, I mean, local areas have used different approaches, but it has been a real development opportunity for an analyst or performance colleagues in terms of working with our EIF research and evidence colleagues, and also sort of looking at the analyst role from a slightly different perspective in terms of kind of that focus on evidence rather than sort of maybe a previous kind of performance focus, and really looking at that sort of evidence generation and thinking about the impact. So it's just something that we're willing to sort of work through with you, but just to highlight that it can be really helpful to identify that resource. I think there's a really important point there about kind of working with partners, and I think Kate and Laura touched on sort of how they brought partners into the process, and that can be tricky, but it's something that is really important, I think, to the success. And all of the local development projects from last year identified that sort of regardless of what they were working on, one of the key sort of outcomes was around that kind of increased awareness of partners, and really that a much more sort of joint approach. So that feels quite key. And I think as well, just that strategic buy-in can be really important, and we've seen that to be important in the past. There's also some sort of help that we need from you in terms of the contributing to the learning and the development of the projects. Karen touched at the beginning on the fact that as well as sort of supporting you to develop and progress your RPC agenda locally, it's also really, really helpful and important learning for us as an organisation to develop the tools and the resources that we have, and to make sure that local areas can use those in a broader context, so outside of the scope of the local development projects. So we're really, really keen to understand the challenges, to work through those. And so we asked you to keep a sort of informal learning log, which also contributes to a case study, which we'll develop sort of through the course of the programme, so that other local areas can hopefully learn from those case studies and learn from your experiences, and then kind of build that into their own work. And we'll also be looking at how we can update and refine the tools, and we really want to do that sort of as part of the process and based on our discussions with you. And as I mentioned on the previous slide, there's some shared learning, that opportunity to kind of come together in those shared learning events, and just there being sufficient capacity to take part in those events. And of course we'll work with local areas as best as possible to schedule those sensibly, and to work with you to organise that. But just that's a kind of key factor of the programmes, especially this year, and hopefully will be really helpful in kind of having that small sort of community around that piece of work to share ideas and learning and challenges and work through those together. So I'm just going to talk very briefly around the application process before I open up to any questions. So if there is anything you have thought of and you want to pop it into the Q&A, please do so, and there'll be an opportunity to go through those in a little while. But just in terms of the application process, so what we've done is we've put together a survey for local areas, and we're really requesting some information regarding some of the following areas. So it's really helpful for us to understand kind of where you want to focus your work. So there's the fairly discrete projects, so there's still discussions to be had around the needs assessment and the outcomes framework and what your aims and objectives are for that piece of work. But if we're looking at working on one of the other 5 projects, there's a discussion for us around kind of where your areas of focus are and what the rationale is for that. There is an opportunity within the survey, if you're looking at both areas, or all 3, to indicate that and just explain that a little bit more. And it's likely that we will have to sort of agree one with you for the focus of the local development project. But if you are looking at working on all of the areas, it's really helpful for us to know that. It's helpful to understand what the challenges are locally in terms of your Reducing Parental Conflict programme, just an honest assessment of sort of where you're at and what the difficulties are and the challenges are. And in that, it's important as well to understand kind of the local capacity, and as I touched on earlier, kind of those areas that we've identified as being quite key to the successful completion of the project. Just really understanding from you what's feasible, so that we can discuss and work on that. And also there's a question in there about partnerships and whether you would consider working in partnership with another local area, and really whether that is already existing, and we can then look to sort of work together, and sort of, so we're very happy in terms of a joint application if your RPC programme is sort of part of a network or a group of local areas. We'll definitely consider that. So it's just an opportunity to highlight that. And then there is an option if there's anything else you think it would be important for us to know. So if there's anything outside of that you think is key or may affect the delivery or may impact the project, or anything that kind of you feel is important, there's the option to kind of add that as well. We have tried as best as we can to sort of minimise the number of questions, and also kind of the we've limited the word counts and things like that to try and keep it as simple as possible, but whilst getting enough information to really understand whether we can offer the right support to help you progress your RPC programme locally. So I have got a link to the survey, which Robin is very kindly going to pop into the chat for us as well, so that will pop up very shortly. So just on selection criteria, and it sounds very formal, but we're really keen to work with as many local areas as possible, but we are obviously limited in the numbers that we can work with. So we've limited it to 15 local areas this year. So we will apply some selection criteria. And as you can see, these are fairly light touch. but they cover the areas that we've discussed in terms of the capacity to deliver the programme and sort of your readiness to participate. And obviously we're working within a certain sort of period of time, and just to think about kind of your capacity around that. And it may well be that following a submission, you know, receiving a survey, that we'll contact you to discuss that in more detail if we do have any questions. So we're sort of very happy to discuss that as well, if that's helpful. And then also just from our perspective, it's important for us just to work from a mix of areas who are at different stages in their RPC work, in terms of kind of understanding some of the challenges to progressing that, and in terms of our learning as an organisation, and also just geographically a mix of areas as well. And so we'll think about that sort of in terms of the different stages of your RPC work. We'll consider that from the perspective of the information you submit in the survey, and also your planning tool information. And we're really keen to sort of build in the planning tool through the project, so you can really understand some of the impact and sort of think about where you want to get to from the perspective of RPC, and how this project can help to support that. So again, there's a few links here which we'll post on the chat, but if you are looking for more information, there's a few places to go. So the expression of interest has a lot of the detail we've discussed today in terms of the structure of the projects, the types of projects, a little bit more detail about the application process and some of those criteria. And you can access that through the EIF website, or you may well have already had that sent out to you. We're working on developing all of the case studies from the areas that we worked with last year, and so far 2 of those have been published, with 1 to come very soon. So if you wanted to sort of understand a little bit more about the local development support projects, they would be a good place to look and to go to. And then finally, we really would encourage, if you're unsure of anything or you want to chat through something that we maybe can't cover in the Q&A today, we are very open to just receiving an email, and we'll set up some time just to discuss sort of from your perspective and from the area that you're working in, and some of those challenges. So if there is anything that you want to kind of work through with us, or chat through, or any specific queries that pop into your head after the session today, please do feel free to get in touch. And that's my email there, which I think Robin will very kindly post in the chat for us as well. And then just finally, to touch on some key dates. So the expression of interest closes at 5 o'clock on Friday the 15th of July. Slightly odd ordering there, sorry for that. And then any further conversations, so I mentioned we may need to clarify things in terms of any responses or anything that we just need to follow up with you. We'll be looking to do that kind of the following week, so that we can then notify local areas regarding selection and non-selection by the end of July. So we're aiming to turn that around quite quickly for you, so that we can then start thinking about the project setup in August. So there will be a memorandum of understanding which just sets out sort of your expectations from us, and what we would expect from you in terms of the projects, and just sort of arranging the structure of the project. So fairly light touch in August in terms of just getting that set up, and appreciating we may need to work sort of around the holiday period there. And then really the project start in earnest in September, in terms of that sort of joint kick-off session, and also thinking about the first stages of the project, some individual kick-off meetings as well with you locally, and really starting to think about how we'll take those projects forward over the next months to come. So they are the key dates. I suppose the really important one at the moment, if you are interested in the project, is that first date there, in terms of those expressions of interest, and submitting those by Friday the 15th. I think I am handing over to Karen just to take us through the Q&A.
Thanks, Bethan, and thanks to all the panelists this afternoon. I hope you found it really useful. We've had a few questions already popped up in the Q&A, which we've responded to, but just checking to see if there are any others before we let you go. No, that's fine. So if there are any things that you think of afterwards and want to come back to us with, that's absolutely fine. You've got Bethan's email address in the chat. Otherwise, I think we'll call it a day. Thank you so much for joining us. Hope it's been helpful and useful and answered any questions that you may have. And we'll let you go and carry on with your day. Thanks, everyone. Take care. Bye.
Thank you.